Well, good afternoon, everyone. Welcome to our second session of our webinar Wednesday for our MAP Spirit Week. We have a great session for you today. We have our ACA manager, Miss Danielle Byers on. She's going to go into some detail for the ACA and Health Sherpa on the applications. My name is Brandon Hall. I'm the Learning and Development Manager here at National Contracting Center. Just want to do some quick housekeeping. You guys will be on mute, but I've unmuted everyone on our side. So if you need to talk or if you want to ask a question, I know Danielle will welcome any questions as we go through this session. Feel free to click that microphone button on your dashboard at the bottom of your screen. That will take you off mute. Or if you want to just drop a question in the chat, we will monitor those as we go through. Also want to point out that this is MAP Spirit Week, so our marketing assistance program. So if you have any sort of questions on that, feel free to reach out to us here at National Contracting Center. You can see all the information on our socials. We're on Facebook, we're on Instagram, we're on Twitter, believe it or not, or X now, as the younger generation calls it. We also have a YouTube channel, NCC Agent, on YouTube. This will be recorded and will be uploaded to that as soon as we are done, probably later tonight, first thing in the morning. So feel free to like and subscribe to those videos. Also want to mention our rollout tour. We are hitting the road, going to 5 different cities to talk about the upcoming 2025 plans with our carrier partners. So that information is on our events calendar on nccagent.com. You can find all that information there. With that, I am going to wrap up the housekeeping and I will turn it over to you, Miss Danielle.
Hey, everybody. Good afternoon. We are going to look at Health Sherpa today. Health Sherpa is the enrollment platform that NCC is providing agents to enroll under 65 plans. It is not mandatory that you use it. I will say I think it is the easiest platform I've used. I've used some carrier direct platforms, but the negative to those is they only show you themselves. And I've used healthcare.gov, not my favorite. It has a lot of glitches in it. And while Health Sherpa links to healthcare.gov and you have to integrate with the marketplace every 12 hours, actually, I do think it's probably one of the better platforms we have used. And we are going to spend a little time walking through Health Sherpa. But this is the main screen. You can see here in the top left, I'm listed up here. I'm already logged in, but this is the main screen. I'm just going to click sign in so you can see, but it makes you sign in each time. This is where I was discussing the integration with the FFM. This is something new. Before, about a week ago, you only did this every 30 days, and now CMS has changed it to every 12 hours. It's nothing to worry about if you're not on here, but once a week, it will just ask you to do it when you come on, even if it's been more. But you can see here, I have 11.5 hours left because I just integrated before we got ready to start this. So I'm going to say skip for now because I'm already integrated. This is the main screen. The home screen here is called your dashboard a lot of times. If you are anywhere in the system and you don't know how to get back to there, you can always click on your name here in the top left and it will take you back to your dashboard. But this main dashboard screen gives you news, tips. There are training videos and things here. It will help you with running a quote, starting an application. There is a demo here. You can go through an app similar to what we're going to do today. And I do normally do a one-on-one training with agents that want it. So if anyone is ready to go and wants to do that, we can do that separately too. I do want to talk about this invalid action for a minute before we learn how to use the system. As of last week, July 19th, actually, CMS made a change. Prior to the 19th, anyone could come on here, go to search marketplace here at the top right, pull up someone with their name and date of birth and city or their social, and view their existing application, see what they had currently or in the past. But as of the 19th, CMS has decided they are not going to allow that anymore without a few steps being taken first. We're going to look at that. But if you are helping a customer make a change to an existing, it's possible you will get this invalid action error. And there are a couple things, like I said, you can do, but the main thing it's asking you to do is to make a 3-way call with your customer to the marketplace. So the customer can tell the marketplace they want you to be their new agent. They are working on getting more down to the roots of why CMS made this change in the middle of the year. And Health Sherpa puts out some email posts about it. But for now, if you're helping a customer that you didn't originally write, you will see this invalid action or invalid action error. And there are steps there that'll tell you what to do, but you can always reach out to me should you need to with questions on that. All right, so what I want to do is show you, there's 2 ways to use Health Sherpa. You can come in and run a quote first. If you're not face-to-face with your customer, you can always email that quote to the customer. I'm going to show you that. And then from there, you can add the chosen plan option to your cart like you would if you were shopping on Amazon, and then start an application. The second thing you can do is start an application first and move through the process of the application. That will calculate the subsidy and premium assistance, cost sharing reduction if there is anything that they qualify for, and then it will allow you to pick a plan from there. So today we're going to start out doing the quote first. I'd like to just show it to you that way, and then we will move through it to the application. So what we're going to do here is in the top right corner, there is quote on exchange, quote off exchange, and quote dental. I chose quote on exchange. On exchange means it is through the marketplace, and if the prospects qualify for any type of assistance, they can only get that by going on the marketplace. So what we're going to do here is just run a quote. I'm going to use my information since this is a test. After you put in the zip code, it will ask you to verify what county you are in if that zip code crosses more than one county. Here you're going to list who is applying for coverage. And to make this a little better, I'm going to put in a family's information. I'm just going to make it up. So just so you can see how the process works a little bit. So we're going to put in, we have a 35-year-old male. It's asking if he has used tobacco. And it tells you here when you hover over that to be considered a tobacco user, you have to use 4 or more times a week for the last 6 months. If somebody does not meet that, then they are considered non-tobacco and you don't have to check the box. So I'm going to say that this gentleman is non-tobacco. They ask if they are the parent of a child under the age of 19 who lives with them. Even if you do not claim them on your taxes, it tells you. So we're going to say yes, because we're running a quote for a family here. And then, are you eligible for other coverage? This is very important. And as you can see, it's telling you to select that box if the applicant is eligible for coverage through Medicare, Medicaid, or CHIP. CHIP is the Tennessee Children's Health Plan. Or if they have a job that is offering them affordable coverage. Selecting this box means that this person is not eligible for any type of savings. So if they have an opportunity to be on a group plan or on Medicare or other type of plan, they cannot get any kind of subsidy. So for our quoting purposes, I'm just going to leave that blank so that you can see how the process works. Now we're going to add a spouse. Same process. They have a child under 19 because they're married. It asks if they are pregnant also. The reason for these questions is that is all part of the subsidy calculation portion. You're going to add any dependents. So I am going to say they have a 10-year-old female and they have a 7-year-old male. So we see here that they are a household of 4. You can adjust this number if all of these people are not considered dependents on the primary's taxes. And another thing about taxes is the husband and wife have to file jointly in order to qualify for a subsidy. If they file married but filing single, then they don't qualify for any subsidy. So the way they file their taxes is very important in the calculation. So we are just going to make up an income of 100,000. At 100,000, they qualify for $884 a month in subsidy. And subsidy is what the government will pay towards the premium. It is paid by the federal government direct to the carrier, and the member is only billed for any balance due each month. So I am going to adjust this to show you also what happens at lower incomes. At 75,000 for a family of 4, it is saying now that mom and dad are eligible with $644 a month of subsidy and cost sharing reduction, which lowers your out-of-pockets for deductible, co-insurance, co-pays, all of those things. In this scenario, in the state of Tennessee, where this zip code is, the children would technically be eligible for a Medicaid CHIP plan. But we are going to show here that they've already been denied CHIP or that their CHIP is ending so they can be on the same plan with the parents. And if you'll notice, it adjusted our subsidy calculation from $644 to $1,200 a month now because the children are going to be on these quotes we ran. Cost sharing reduction I was just talking about, that is a discount basically on your out-of-pocket expenses. Cost sharing reduction can only be used on silver plans. So if they choose to buy a bronze or a gold, they default on the cost sharing. That's not really doing them any type of service because they're going back to paying full out-of-pocket. So I would make sure you explain that to your customers always when you're showing them the quotes. But I am going to scroll down here on my screen now into the quotes, the plan results that come up. For the zip code I put in, you can see here there are 67 available plans. In Tennessee, the carriers that are loaded are Ambetter, Blue Cross of Tennessee, Cigna, and United. You can click in the boxes here to the left to narrow down if a customer only wants to see 1 or 2 specific carriers. You can also click here under metal levels for your bronze, silver, and gold. This is somewhere with the cost sharing. I do like to show them silver first since that gets them the most benefit with that cost sharing. And then you also can choose if you want an EPO, which is an exclusive network of doctors. It is usually smaller than a regular network. So I don't just look at EPOs. I look at all types of network. The other thing you can do here is add a doctor, and it will tell you on each plan if that doctor is covered. So I'm just using my doctor because I know he's on here and he's always my test dummy when I teach people how to quotes, but I've added a provider. You can add more than one. And I say done. And you can see here at the bottom of each quote, it tells you that that doctor takes this plan. It would be in red here if it said does not take the plan. So that is another way to help you narrow down what to show your customer, because you don't want to show them 67 options because they're, too many choices makes it very hard to make a decision. So what you do here, you can see on the plans what the monthly benefit is. This one you can see the premium is $0. The premium should have been $1,178, but this family qualified for over $1,200 in subsidy. So they would basically pay $0 if they chose this plan. You can see the main benefits here: deductible, out-of-pocket, doctor visits. But if you click on plan details, it does bring up a more detailed chart of how everything is covered, what type of network, what metal tier they're in, what doctor copays, prescription copays, all of these things would look like. That is available on every plan. And when you send this to your customer, the link to look at this will be live also. So I am going to go back where I was, scroll back down into my plans, and I am going to ask it to show me only silver because of the cost sharing reduction. So you can see here, when I narrow it down to silver only, the lowest priced plan using the subsidy calculation and giving them their cost sharing option is $249 a month for this Blue Cross plan. This plan, it tells you here what the plan is called. See, you can see here that Dr. Boroff does not take Blue Cross Blue Shield of Tennessee. So at this point, I wouldn't show Blue Cross to my customer unless they really weren't very concerned with keeping the doctor. Some people are, you just have to present that to them and find out. But what we're going to do here, I am going to click compare here because I'm just going to say this looks like a good plan for what the customer told me they would like. And then I'm going to scroll down and pick some more. You can see across the bottom of my screen here that plan I chose to compare popped up, and it is telling me that I can compare up to 5 plans together. So I'm going to go through down here and pick a few other plans for these customers. I am going to show them and better because it takes the doctor they want. And I'm just going to randomly pick a couple of other plans just so you can see how the process works. So I'm going to give them 3 different carriers. Like I said, you can give them up to 5. But when this part is ready, you can hit here, compare these plans. And it will bring them up in a nice fancy spreadsheet form so you can look across each column and compare what you're coming up with. From this point, I was going to say, Affordable Care Act does allow you to do quoting and enrollments face-to-face with your customer. They allow you to do it over the telephone with your customer. As of 2024, they do require a consumer authorization form. Basically, that form is giving you permission to fill out the app for them, and it also gives you permission to sign the application on their behalf. So it is not required any longer for you to actually be face-to-face sitting down with someone to help them enroll in the marketplace. If anyone has any questions about that authorization form, afterwards, let me know and I can send you some examples. It's a very loose rule in that the agent needs to collect it. The agent needs to maintain that record for 10 years, but you don't have to send it in. You can attach it to HealthSherpa, but it's not a requirement. So what I'm going to show you now then is we have our quotes, we have all our comparisons. As I was telling you earlier, all the links are live. So at the bottom here, you can see plan details, summary of benefits, all of these. Once you email this to your customer, they could click these links and see more details. They also can here at the top, click to add to cart and send that plan to an application. If they wanted to enroll themselves, you would still receive credit as the agent because it was sent from your HealthSherpa account. So I want to share this. So I'm going to hit share here at the top, put in my client's email address. I'm going to use my own. And then it does have a pre-populated subject and a message here, but you can make changes to that. Your name and phone number populate at the bottom, and then you'll hit share. And you can see down here at the bottom, it tells me that an email was sent to that email address. So at this point, normally, if you're not with your client face-to-face, you've prepared a quote for them, you've sent it to them. 9 out of 10 times, the spouses have to discuss it and make a decision. So what you would do at this point is close out this box, come up to the very top right and save your lead so that when they call you back and tell you what they want to enroll in, you don't have to reload all of this for them. But you can hit save lead, put in the member's email address again and their name, and it will save it into your leads list until you start an application. So I have saved it, and as you can see, it populated over here into my leads list. You can see I use this quite often, but it tells you the status where you are, what they're doing. You can resume from here. You can send the quote to archive, meaning it won't be in your list anymore, or you can copy the link if your customer needs to get the quote in another way also. So we are going to go now and open the quote. And what we're going to do is finish by applying and go through the application. So we're going to resume the quote I did. So it's asking who is applying for coverage. Do you want to see if they're eligible for cost savings, which we did already see that on the quote, but this is part of the application where you can put in more details and get a more definitive explanation of what they qualify for. So they're wanting to know who else is applying besides Danielle Byers. So I am going to add a spouse. You can see I typed a little punctuation mark there, so it's giving me a notice that I need to fix that. And I'm going to add a spouse and save them. I'm going to add children. I do want to edit this because originally I quoted someone at age 35, and then I just put in my husband's real birthday. So that's not going to work. It's going to recalculate everything that way, and I don't want that to happen, but I'm showing you how easy it is to edit something when you've put it in wrong and you need to go back and change it. So I'm going to say 1989 since we put in that he was 35 earlier. So now it's going to ask household information. You would put all the family members' info in there. Who is my spouse? I know I just told it that, but here we go again. A lot of questions it asks on here are redundant, I feel. Do they live with you? The reason it asks these questions is for tax calculation purposes, for your subsidy, because all of that is based on how you file income taxes and who is a dependent. So do you plan to file a tax return for 2024? You must say yes, or it will not give them any subsidy information. Are you filing jointly with your spouse, like we talked about? Are you claiming any dependents? You can say yes also. Do they live with you? And then continue on. And I don't want to confuse you, but I did change everybody's ages, so the subsidy is going to look a little different. It is asking if my child is married. The rule since ACA began is that you may keep your child on your health insurance until after they turn age 26, even if they are married and whether or not they are a student. They don't ask any of those questions. If they are your child, whether or not they're your tax dependent, they can stay on your health plan. If they're not a tax dependent, they are not counted in the subsidy, but they can still be insured. So it's asking who Todd Byers is, and you can see I spelled that wrong up there. He is the parent. Do I have anyone else under the age of 19 that lives with me? Yes or no? And then you would add it more people if there were. Because this is a test application we're doing, I am not going to put a social, but if your client has a social, you do need to put it in because they use that when they do the calculation. So I'm going to say no just because this is a test. And I'm confirming, yes, that Danielle Byers doesn't have a social security number. They want to know if you've used tobacco more than 4 times in a week in the last 6 months. Lots of questions about citizenship. If you are incarcerated, if you are an American Indian or Alaskan Native, your origin, if it's Hispanic, Latino, or Spanish. All of these things are not part of the application in them deciding what you're qualified for, but eligibility, you must be a US citizen or have some type of a green card or work visa to qualify, and you cannot be incarcerated. That's why they ask that. If they are an American Indian or Alaskan Native, I would advise them to work through the marketplace because they can get special discounts on the insurance if they are. You do not have to tell your origin if you don't want to. Race and ethnicity, it is up to you what you want to put in here, or if you want to say you decline to answer. It's asking what the client's sex was assigned at birth. They can prefer not to answer that as well. What gender do they identify with? You don't have to answer any of those, but they are just collecting them for purposes of tracking. It's asking if the client is a naturalized or derived citizen, or if they're pregnant again. And I do apologize, it does ask a lot of questions multiple times. It seems silly that you have to keep putting that in there, but I don't know if their government is trying to verify, but they ask quite a few questions multiple times. They also ask if you have authorization from your customer at least 3 times in the application. Do I want to include my spouse's social? I'm just saying no. Are they Indian? Are they Hispanic? Same questions we looked at earlier. For my child, same questions. Because of Kira's age, they ask if she was pregnant also. Does your client currently get any income? We had already said this family made $75,000 combined income, but now it's asking, where does Danielle's portion of the income come from? I chose a job, but you could put self-employment, Social Security, pension, any of the choices. It does ask the employer's name and phone number, how much of that income comes from that employer, and how often they're paid. I put it in annually. You can put the street address if you'd like. Be sure you save it so it doesn't disappear on you. They want to know if you have any deductions for 2024. And then they're asking you again to confirm that my income is $45,000, which I just put in. Okay, now it's going to ask me all the same questions for my spouse. I'm going to say no here just to make this process a little faster, but you would put the real information for the spouse here. It's asking if you would like to see a list of what to include in income amounts, so you can always drop down that list if you have questions about different things like Social Security, disability, alimony, any of those things. I'm going to say Kira does not have an income, and I'm going to confirm it's 0. Does anybody get any extra help for disability or mental conditions? Does anyone need help with their daily activities? Was anybody on TennCare Medicaid or Cover Kids between 3/31 and 7/31? I say no. Was anyone found not eligible for TennCare? And I know this seems like a very long process, but this is applying for them to see if they qualify for premium assistance. So it wants to know if you are currently enrolled in a health plan. I'm going to say no. Because we are not in open enrollment, you must have a special election period to qualify for a plan. But we are just going to tell them we've had a loss of group coverage for this test purpose. It is asking if anyone has a health reimbursement arrangement. We're going to leave those blank. We will do a training in the future on the ICRA and health reimbursement accounts. But for today's purposes, we're just learning the application. Will any of these people be offered health coverage through their job? I am not going to click it. That's the reason this couple is looking for insurance, because they're losing it. So it's asking, will anyone lose qualifying coverage before 9/29? I'm going to say yes. And the last day this person is eligible is the end of August. If I would like to put my carrier's information, that is optional, but they're asking to select the qualifying event. I'm going to say that I am losing group coverage. I'm going to put the same date I just put up there. It doesn't like my date, so I'm going to put today just for purposes of getting through here. Okay, so we are ready to finalize the application. This is where you would go through everything you put in with your customer and verify that it's correct. There are edit buttons on each section. So if you see something that is not correct, you can go in there and make changes. I'm going to change the date of birth here. We're going to go through here and verify everything. It's asking if everybody lives at this address. If I'm married, it's asking me again. I'm still just verifying everything that I put in earlier. And continuing through each page. So if your customer has any changes, you can do that as you're going through here. Okay, so we're back to the finalized screen where we were. I'm just going to continue. There are agreements here about renewal eligibility, and it is asking if the customer agrees to allow the marketplace to use their income data, including tax returns, for the next 5 years. The marketplace will send them a notice and let them make any changes, and they can opt out at any time if they say yes. I do want to say, if you do not agree to this statement at the end of each year on December 31st, your client's coverage will end instead of automatically renewing to the next year. So that is something you need to make sure they understand, because a lot of people expect it to continue into the next year. This is the tax attestation saying, do you understand? I'm saying yes. And then here you would click agree. They agree to the statements that they're allowing the marketplace, the application to be enrolled. And this is either they agree or they don't give permission. And then you agree and you type your client's name here as a form of signature and continue. I'm not going to continue past this point because we don't want our fake application really getting submitted. But the next step, it will come up and give them a letter of eligibility. You must view that letter with your customer. You can print it or save it to your desktop or client files online, but you must view that before the gray button will pop up to allow you to submit the application. But once the application is submitted, it will, if there's any documents needed or anything required, it will list them. You don't have to worry about writing them down or keeping track, because they will all be on your main Health Sherpa dashboard once we get back to that. Everything that's necessary, whether they have paid or not, when a payment is due if they didn't, any forms they need, if they need tax returns, if they need a copy of a Social Security card, a green card, anything, it will list it for you and tell you. You can scan those and submit them right here through Health Sherpa. But I'm going to take us back to the dashboard. And remember, I did not submit that one, but we have gone through how to do a quote and then how to do an application. If anybody wants to unmute themselves and ask a question, they can. They can also type it in the chat box across the bottom of your screen if you roll your mouse down there. And while we wait to see if anyone has any questions, I do just want to remind you all that I am happy to go through this with you one-on-one. And I have been for a lot of new agents, helping them in their first few quotes and enrollments, even being online as a third person with them and their customer, just so I'm there. If they have any questions or anything pops up and they get stuck, I am here to do that to help you out also. Let me see what's in the chat here. Okay, so what if we are self-employed with a business account? Josette, are you meaning to enroll someone as self-employed, or do you mean you as the agent have a business account? If you want to unmute, you could just talk to me if that's easier.
Hey Danielle, how you doing?
Hey, Josette, good. How are you?
I'm doing great. Yeah, because I need to sign up. So I was just wondering, to just
Okay.
have a, the
So
income
to
like
enroll yourself, you are allowed to do that. You would need a special election period if you tried to do it now, or wait till open enrollment. The open enrollment period is very close to Medicare. It's November 1st to January 15th. But if you wanted to enroll yourself, you can do that. There is a form, it's different in every state, but a SHOP account, which is a small group plan. but NCC is only doing the individual side.
Okay.
Does that help you, or is that more confusing than I started with?
No, you're fine.
Okay, okay,
Next question.
go ahead.
So if we sold last year, do we
Yes.
have to recertify again?
You do have to recertify every year. If you were certified for ACA in 2024, you can choose to do the renewal returning agent, which is even shorter than the test you did last year. 2025 testing certification has not been released yet, but we are expecting it by the end of August. And I will send an email blast out to all NCC agents when we hear that it's up and running.
Okay. Last question. Are we going to be contracted with Oscar and Aetna?
Yes, ma'am. Both of those, we have an agent going through as our first downline as a test to see what the process is. And as soon as we submitted 3, Oscar, Aetna, and Alliant are 3 new ones we were getting. Alliant got finished this week, and Oscar and Aetna should be ready to go at any time. The NCC contract is done. We're just waiting to be able to appoint downlines, which is what you guys are, downlines to NCC. So that should be any time. I would hope in the next few weeks we'll be able to do the Aetna and the Oscar.
Okay, thank you.
You're welcome. Does anybody else have any other questions? We do appreciate you coming on here for our webinar Wednesday for our Spirit Week. If you need anything, you can always reach out to me. My number is 865-350-6523. Oh, I do see a question. Christy, that Aetna and Oscar, that was for ACA. The Medicare side is already done. This is just the ACA side we were referring to. Brandon, thank you. He put my phone number in the chat session too for you.
Oh, the authorization form. Do you send
Yes.
that over to us?
I can. I have 2 different examples that you can use. If you do Medicare, you know the scope of appointment is very strict, what it has to say, how it has to be, but the consumer authorization only has 3 or 4 pieces of information that are required. So you can make the form look how you want it. You can also record a call with someone saying they give you permission. You can have an email from them saying they give you permission to do their enrollment and sign their name. But Josette, I will email you the 2 copies of the forms I have. Okay, Christy, I'll send them to you too. All right, does anybody have any other questions? Well, I appreciate you all getting on here with us today. I'm sorry if I went over a little bit. I did not think it would take that long to learn how to do an application, but you never know. So please reach out. Please let me know if anybody needs any help. And otherwise, we will be seeing you again soon.